Hello everybody, my name is John Robinson, aka the Hospice Guy. November is designated National Hospice and Palliative Care Month. In the next 30 days, I will be posting a video each and every night about the different aspects of hospice pertaining to your hospice team, your caregivers, and also the signs and symptoms you are going to address and see on an end-of-life journey. I have been a hospice professional for the last 16 years in southwestern Pennsylvania. And about 10 years ago, I had a supervisor ask me, where do I see myself in 10 years? Well, I told her I would love to be synonymous with the word hospice. And this is my first step on that journey. So I invite you to come along and we'll just see where this goes. Tonight, I would like to cover what hospice is. I also would love to cover the freedom of choice. And last but not least, we're going to cover mental versus physical readiness. What makes someone eligible for hospice? You know, first of all, in order to be eligible for hospice, there has to be a doctor's order. And it states that if your disease process progresses naturally, that within the next 6 months, your passing is imminent. Now, sometimes people are on hospice for more than 6 months. Sometimes they are on for less than 6 months. Everybody is completely different. But hospice is support for you and the caregiver. Hospice is a supplement to the care that you will provide your loved one. It is mandated by Medicare. It's paid out to a certified licensed hospice through Medicare. You know, the most important thing is freedom of choice. A lot of times when you are in a facility, in a hospital, in a nursing home, you often hear the administrator say, well, we don't take this hospice or that hospice. We don't work with them. And you know what? That's actually against the law because you have the freedom of choice to pick any hospice that you choose. Nobody has the right to say, well, guess what? I'm not working with this hospice or that hospice, therefore you have to go with this one. Your freedom of choice is the most important thing, and if someone tells you anything different than that, you know, there's a telephone number that you can call and you can report them. Because it is important. It is rarely, very, very, very important to have someone that you trust, someone that you love, to come into your home and to take care of you and to guide your loved ones on this journey. There's no more important thing in life than that. You know, if you're in a hospital and they say, well, we don't have a contract with this hospice, well, tell you what, they can get one because no matter what, Medicare reimburses the same amount to every hospice throughout the United States. So for anybody to say that, they're completely wrong. So please always exercise your freedom of choice. And lastly, I would like to cover the criteria, let's say, for hospice. And it's the physical criteria as opposed to the mental acceptance criteria is what I call it. If somebody has cancer and they no longer seek treatments and it's end-stage cancer, then that would make them physically appropriate for hospice. If somebody has lung disease and their capacity is 15% or less, that makes them physically appropriate for hospice. If you have a cardiac issue and your ejection fraction is 20% or less, that makes you appropriate for hospice. A lot of times I hear, well, mom or dad doesn't want to go back to the hospital. They don't want to go back to the doctors, therefore let's bring in hospice. Well, you know what? Just because you don't want to seek treatment or do this or that, that doesn't necessarily make you eligible for hospice. First of all, you have to meet the physical criteria for whatever disease process you have. Then it's a process within your mind. Am I ready for hospice? If the two coincide and meet, guess what? Then you're ready and you can make that call. That's the most important thing. And you know, when I come into somebody's house, I tell them, I'm here to tell you what you need to hear, not what you want to hear. Because sometimes people make decisions just because their heart tells them to do one thing. And that's what we're here for. Kind of play a devil's advocate type thing. And hopefully along the journey somewhere, we can meet in the middle. Because I'm there to meet patients where they are, not where I am. I have 16 years of experience of doing this every day of my life. And the most important thing is I can provide you and your loved one and the caregiver with respect, with dignity, truth, and compassion. I supplement the care that is provided for you. I'm not going to be able to be there 8 hours a day, 10 hours a day, but I will manage or help you manage your symptoms, no matter what they may be. If I come into your home and you're uncomfortable with me, or anybody else in the hospice team, you need to say, okay, you know what? I need to have someone else come in because I'm not comfortable with that person. And that's fine and dandy. That's not a problem. You know what? So tonight I kind of covered what hospice is. I covered the freedom of choice and the mental versus physical readiness. You know what? But I'm here, like I said, to provide you with love and understanding. I'm not going to judge you at all for what you think or how you think. I'm here to support you. And please, any hospice should do that. No hospice caregiver should come in and tell you what to do, how to live your life, how to do what you need to do. That's not my job. Like I said earlier, my job is to meet you in the middle and support you in any way possible. So I hope this helped a little bit. And tomorrow night, we're going to talk a little bit about the patient from the time of diagnosis. Some planning that needs to be done, which I love 5 wishes, which designates a caregiver, a power of attorney for any type of medical decisions, but we'll address that tomorrow. Oh boy, my name is John Robinson, aka the Hospice Guy. May God bless, and may you have a great evening.